Experts are warning the health service to brace itself for waves of patients with post-lockdown stress disorder, as the UK lockdown measures could unleash an even bigger public health crisis. With Britain approaching a third month in lockdown, it's thought the measures to defeat the virus could lead to more and more people falling victim to a mental health pandemic. A new form of post-traumatic stress, fuelled by disruption, isolation and financial insecurity, could even be more deadly than the virus itself. Research from King's College London found the last recession led to 10,000 additional suicides. And to discuss this, I'm now joined by returning NHS doctor Bilal Hassam. Dr. Hassam, thank you for joining us. I mean, you're one of the first to suggest this post-lockdown stress disorder. How similar do you think it is to PTSD?
Well, really, it's not a question of if, but when we see waves of individuals who start to exhibit a range of symptoms which really mirror post-traumatic stress disorder. Now, most often we hear of PTSD in the context of war. Now, you'll probably remember at the beginning of this crisis, Boris Johnson and many other world leaders used the analogy of war, that we're on war footing now. When we think of war, there's loss of life, there's fear of harm, there's limitation of movement, there's insecurity, and all of this has been paralleled by what we experience right now in the lockdown. So as all the research has indicated for many, many years, that any degree of quarantine, even a 10-day quarantine, can result in mental health challenges that last over 3 years.
So do you think the health service is ready for the waves of patients that you're suggesting?
I left the NHS about 4 or 5 years ago. And really, when I left, the NHS was already on its knees and it was experiencing all of the effects of, austerity. Since I left, things have got a lot worse. And having returned now, the NHS is really, really struggling as it is before COVID. So really, I'm not confident that our healthcare system and infrastructure are ready to deal with the waves of patients that are inevitably going to be coming.
Well, do you think then that the government should consider this when they're lifting the measures? I mean, do we need to slow down, easing back into normal life? Are we going at the right pace?
Well, absolutely. And I think perhaps this can be a real clarion call with regards to how we as a country and as a culture approach mental health. It can no longer have that stigma associated with it when we can expect up to 1 in 4 people in our country to experience symptoms like this. So I'm really hoping that the government can take this on board. And it also requires a wider societal response. It's not just for the government, but we need to think about economic responses, cultural responses, social responses as well.
Also, you mentioned that figure then of 1 in 4. Therefore, might this affect children? If so, how?
Well, again, the research shows that children are even more sensitive to experiencing an impact on their well-being. If you think about it, we've told our children to stay indoors, to not see their friends. They've not been able to go to school. Now, under normal circumstances, that would be called child abuse, and for good reason. So we really need to be extra sensitive to how this will impact children. It's complicated. It requires a lot of attention and a lot of resources as well.
We said about attention and resources there. So what can people actually do to protect themselves and their families, their children, from the mental health crisis?
Well, the normal sort of advice that you'd give to an individual who's beginning to feel stress on their well-being, you might tell them to go to the gym or see some friends, even plan a holiday. We can't do any of those things. So we have to be a little bit more creative. And this is where non-traditional providers come in hand. I work for a charity called PennyAppeal, and we launched right at the beginning of the crisis, we launched a helpline service for people who felt that their mental health was under stress or was being challenged. And what's so surprising is that so many people have accessed our helpline, and these are not people who would ever have thought that they would need help from a mental health perspective. So what we need is real societal solutions, and we need to tell individuals that it's not weak to seek help. There is a lot of services out there, whether it's ours, whether it's if you just look online, there's plenty of educational resources. Often we have that stigma with mental health. We try and brush it under the carpet. But with so many of us experiencing these sort of problems, and when we factor in the economic crisis, the political crisis, the social crisis, in addition to the health crisis, it's only normal to feel overwhelmed and stressed out. So please, the real call is to ask people to seek that help and hopefully get on the right start.
Indeed. We'll leave it there. Dr. Bilal Hassam, thank you for joining us.
Thank you.